Hi, Marcy Doderer, CEO of Children's Hospital. Welcome. How are you today?
Good morning. I'm great today. How are you?
I am so good. I feel so honored and have so much gratitude to be able to speak with you. So thank you so much.
I'm happy to be here, Claire.
Yeah. So just give us a brief summary. I know brief may be a little difficult. So tell us, who is Marcy and what has the journey looked like for you?
That's a really big question. Who is Marcy? So right now, I guess I'll start professionally because that's always clean and sleek and easy. But I'm Marcy Doderer, and I get to serve. I really have the true pleasure of serving as the president and CEO of Arkansas Children's, which this day and age is really so much bigger than Arkansas Children's Hospital because we've formed a dedicated pediatric health system right here in Arkansas just to take care of all 720,000 kids that are in our state. We have our newest hospital in Springdale, Arkansas Children's Northwest. It's flagship, really, the thing that everyone knows in the state, Arkansas Children's Hospital here in Little Rock, and a variety of other places and pieces of business that we are growing and planting our flag all across the state of Arkansas so we can reach those kids. Our tagline really is, how do you get care close to home and reach more kids where they live, learn, and play? Yeah. So that's who I am professionally, a businesswoman, a CEO, and really a passionate advocate for children's health care.
And I love
I'm
that.
a life. I'm a mom. I'm a sister and a daughter and all of those other things that come with it. I grew up in Little Rock. Graduated from Little Rock Central High way too many years ago to count right now. So there might be people watching this that went to high school with me. And what's, I think, pretty cool about my journey is that I was actually a candy striper at Arkansas Children's Hospital way back in the day when I was 14 and 15.
Nice.
My first paid job was actually here. And then I went away to college and grad school and never thought I'd come back to Arkansas. And
really?
Yet 5 years ago, when this position became available, I threw my hat in the ring and became just really impassioned about getting back here and have loved every minute of it since. And it'll be 5 years in July.
That is truly wonderful, Marcy. I love that. You know, I think I shared with you in the questions I sent that many times the road seems crooked. But it's really straight all along, and your journey definitely depicts that. That is an amazing, amazing story. I love that.
Yeah, I tell people that my job hasn't been linear. Like, you know, some people, you're in one company and you kind of march up that career ladder, as they say. And I've been in big adult hospitals, small rural hospitals, a small children's hospital, and now this. But my ultimate aim was really to become the CEO of a freestanding children's hospital, and I got it. I'm here.
Right. And it's right where your roots are, which I think is so important for Arkansas.
Yes.
Yeah.
Makes a perfect picture.
Absolutely. And your father was a physician, correct?
Yes. My dad is retired now, has been for 20 years. He is a pediatric cardiologist by trade. And the reason we got here was in 1975. He was recruited by UAMS and Arkansas Children's Hospital to come build a division of pediatric cardiology and start a heart program right here in Little Rock. And so that's why my family moved here in 1975. And he retired, like I said, not quite 20 years ago. And my mom actually moved away from town after they retired, and they have since moved back once my family got settled here.
That is awesome. So fantastic. Well, thank you for being here. Thank you for coming back. Thank you for building what we have. And
it's my honor, actually.
Yeah. Well, so much gratitude abounds, and I love it. So let's get to the meat of what is Arkansas Children's doing within the state. I know you mentioned the growth that is happening up in Northwest Arkansas, and that is huge and has been developed since it's been under your leadership. So tell us a little bit more about that.
So Arkansas Children's Hospital has been in this place and taking care of kids in Arkansas for over 100 years. And our business, typical of a hospital, shouldn't surprise anyone, was to take care of sick and injured kids. And we did a great job pulling them in from around the state, taking care of them right here in Little Rock. Kind of a hub and spoke system, you might say. Physician practices, general pediatricians and family medicine docs all across the state, small community hospitals would land with a kid who was a child who was sick or injured, and they would transport them into Little Rock, and we would take care of them.
Right.
And that is still a business model of ours. As a hospital, we take care of sick and injured kids, really critically ill kids, and not so sick kids. But a couple of things have changed. The dynamics of our world have changed. One, a lot of people don't have any interest in driving 2 or 3 hours from around the state into Little Rock, particularly for outpatient services, a 30-minute asthma clinic visit, for example,
Right.
or a short outpatient surgery, or even just a 1 or 2 day stay in a hospital. People don't want to travel anymore. It's really inconvenient, and it's actually impossible for some. And so we knew we needed to create places, spaces where that healthcare could be delivered in different places across the state. So we have built in the last 2 years a small children's hospital in Springdale. We call it Arkansas Children's Northwest. It's been open since February as a full-service children's hospital, though it is much smaller than here. We are so excited to have it open. And that community, I can't even begin to tell you the excitement the community has to have that facility.
Yeah.
But we're also building clinics. So we have a clinic in Jonesboro, and we just got board approval this week to expand the services in Jonesboro. We're excited about that.
Nice.
We built a new clinic in Southwest Little Rock where pediatricians had not been, and taking care of all kids in that area, but also very specifically Spanish-speaking families. That was new for us.
Mm-hmm.
We're also building what we call a Nursery Alliance, so working with community hospitals who have newborn babies in their hospital, working with them in Pine Bluff, Hot Springs, Conway, and hopefully soon a couple other communities across South Arkansas. So we can help make sure when a mom delivers a baby who might be a little sick and is staying there now, we can elevate the care and keep mom and baby
together
right there at home.
Mm-hmm.
If the baby gets really sick and needs our level of NICU, we could transport more easily.
Mm-hmm.
Then really important is to get a conversation going between all of those nurseries.
Yes.
And finding out what's best practice for taking care of mom and baby now, and how do we help Arkansas keep our babies healthier. Arkansas didn't have a great track record for child health. We rank like 45th out of 50 states, child health and well-being. Personally, I'm really embarrassed by that statistic.
Right.
So that's part of my passion to say, what can Arkansas children do differently, not just in health care, but in raising health. And I think all of these things start to answer that big picture. How are we going to improve health, not just healthcare delivery? So that's kind of what we're doing these days.
What I hear in all of this, Marcy, is that there was a limit. There was a limit there of getting people to come to the mothership of Little Rock. And you saw no limits. And you said, let's go to them. And you found a way.
So that's part of my personality, is not to be bounded by traditional guardrails or limits. And I push that envelope often. Sometimes I do it very elegantly and it plays out really smoothly. And sometimes I trip and fall over that guardrail.
Well,
and
I call that failing forward.
Yeah. Mm-hmm. Good description of it.
And we pick right back up and move forward again.
Try a different path forward and try to do something different.
That's it. And that is a beautiful thing. And so I love that vision. I love that vision of making sure that our vision at Children's Hospital of providing quality healthcare for any and all children in Arkansas is there, and then making sure that happens. And then is there a vision of making sure that preventative health care is provided for any and all children through this networking that you're doing throughout the state?
Absolutely. And it's hard to measure that. So there are lots of surveys that rank our states across the country by child health and well-being, the Annie E. Casey Kids Count report, the Robert Wood Johnson Foundation report, any number of things. Mm-hmm. So what we're trying to figure out is, how can Arkansas Children's, as just but one institution, we may have many points of services and places to connect with families, but we're only but one in the state. How can we convene others, be what I would call the aggregator of the conversation, the convener of the conversation, and start to move the needle on individual metrics? Right. Like the Nursery Alliance. Can we move the needle on infant mortality, which infant mortality in our state is higher than the nation's average? Actually higher than many third world countries. And that's measured by how many children die in the first 1 year of life. So what can we do to change infant mortality and lower the risk to newborns in our state? Yeah. We're looking at obesity. Very specifically, we are raising a generation, no holds barred there, of fat kids. Yep. And what are we going to do? It's a big problem, pun intended. Big. So we've got a conversation happening internally in my team. We call it the big idea. We don't know yet what exactly that looks like, but it's how are we going to tackle obesity across the state? I know We're also really silly in children's healthcare, so we play on words quite regularly. And we know it's a very real problem though, and it's about poverty and food insecurity and access to healthy foods and eliminating food deserts. But it's also about how do you inspire children to be active? How do you make sure school districts still have physical education in multiple times a week, not just one 45-minute span in a week? And it's very complex. It's a complex problem, but we believe we could be that voice to help change those kinds of individual metrics around health as we go.
Absolutely. Absolutely. And you've created telemedicine as well throughout the state. Tell us a little more about that and how it's integrated.
So one particular disease process that we have found can be really well managed remotely via a camera like this is managing asthma. So our asthma team is setting up telehealth and telemedicine sites across the state and in partnership with schools as well, so that kids who have really severe asthma don't always have to drive into the allergy specialist in Little Rock, but we can do a full assessment of them in the moment, particularly if they live in communities. So think about Jonesboro. We actually have a provider scheduled to do asthma clinic for Jonesboro patients in our Jonesboro clinic, but the provider, the physician's actually here in Little Rock. And using telemedicine technology, Dr. Simmons, for example, can do a full, they can look in the ears with the otoscope, can look in the mouth, can see what the blood saturations are, can have the provider on the other end listen to the chest for wheezing, can then talk through the care management plan, what kind of medications, rescue and regular, when was the last emergency department visit. All that can be done in a video, a telemedicine way. Saves the patient time to travel. It's really still effective. The young parents actually have no issue talking into a video camera. Yeah. They're not nearly as uncomfortable with it as I am at my old age.
Well, and what I'm also hearing is this is so affordable.
Yes.
It cuts that affordability factor out. For those that are such a distance away from Little Rock, it cuts on travel. They don't have to take off work.
Right.
They don't have to stay overnight if needed. So there's a hotel, there's meals. The list adds up. And so Absolutely. It makes healthcare so much more affordable within the state.
Definitely. And some families could afford to miss a day of work, but it's highly inconvenient, right? I could take off a day, but I don't want to in order to take a child to a doctor.
Well,
some families don't have that luxury. If they missed work tomorrow, they may not have a job the next day when they got back. And so it then becomes impossible to travel. And this alleviates some of those problems.
And like it or not, depending on the parent, depending on the family situation, they may or may not be able to do that. And then the child doesn't get the health care that they need. And then it becomes an emergent situation later down the road.
Absolutely. So we want to try to deliver that care at the primary level or even the secondary level as close to home as we can get them so that we keep the child out of the hospital. My ultimate goal would be we need a really tiny children's hospital in this state because the only people who land there are ones who have been critically injured in an accident or really the sickest of the sick. If you could really take care of kids close to home in schools and doctors' offices in partnership with churches in their own home, that would be amazing and have fewer beds here right here in Little Rock.
I love this vision, Marcy. And so also, since you've come into leadership, more women have come into leadership at Children's Hospital as well.
Yes.
I love it. So tell me more about that.
So if I looked at my most senior team, the senior vice presidents and up, I think there's now 13 if you count me, and 7 of us are women. That was not true when I first got here, though there's been a long-standing support of female leaders at Arkansas Children's for a long time. I think we are, this as an organization, culturally have supported strong female leaders and not just your traditional nursing leader, but the CFO, the Chief Financial Officer of Arkansas Children's, has been a woman for 20 years, Gina Wingfield. Mm-hmm. We've added our Chief Operations Officer is a woman, my Chief General Counsel, the Administrator of our Northwest Hospital, our Chief Nursing Officer. We've got lots of strong women.
Yes, yes, which creates a whole different culture within the entire community of the administration, and then that when you have that leadership, it then just carries on down throughout the entire organization.
It does. And well, it's challenging in our country today. It's almost sad to say that in 2018, to admit how few women CEOs in particular there are, but even women in the C-suite altogether. Mm-hmm. I don't know the stats precisely off the top of my head, but something fewer than 6, or somewhere only around 6% of all Fortune 500 companies have a female CEO. Now, healthcare is a little better than that. We're advantaged because of our workforce. In general, the healthcare workforce is about 70% female. So you'd think maybe there would be a huge number of females in the C-suite or as the CEO.
Right.
We're only at about 20% are CEOs. So better than the industry and regular business, particularly Fortune 500. But when you think about if 70% of the people walk in my halls every day are women, and yet only 20 or so % of hospital CEOs across the country are women, we're still missing something there.
Why do you think that is, Marcy?
I think it's a number of things that puts women at a disadvantage to land in this chair that I have the honor of sitting in. One depends on their own pathway of education. Were they encouraged, really explicitly told, you have the power to be what you want to be if you purposely pursue it through education and work and find a way to get there. Mm-hmm. I think we are limited sometimes in mentoring other women. I actually had the pleasure of having some strong mentors. My mentors were not women though, mm-hmm. but I had the real pleasure of having some mentors who were men who celebrated women in the workplace, right, and made my path forward a little more direct in partnership with me. Mm-hmm. And so I think women need strong mentors. I also think women, and you can read about this in different places, we are sometimes our own worst enemy.
Yes.
We use words like just. Do you have just a minute for me?
Right.
If you will listen carefully in the workforce, it is rare that a male leader will walk in and say, do you have just a minute for me? They'll say, I need you for a second, or I need you, or I have something to tell you. Mm-hmm. They don't apologize for their presence. Yeah. And somewhere deep in our culture, we've embedded in women the sense that we must apologize for breaking in, for interrupting, for sometimes just being. And so we sometimes are our worst energy, and that enemy that minimizes who you are at the table. If you apologize before you talk, you sometimes shut down half the folks listening.
Yes.
If you are hesitant, if you are too demure, and I'm not saying you have to be abrasive or even aggressive or even assertive.
No.
Some of those words might have been used to describe me at points in my career, but they're not required. You can just be strong.
You can be strong and soft. You can be strong and soft.
Right. You don't have to eliminate your femininity. I can't even say that word. I wear a dress. I wear bright colors. I'm not in a black suit every day.
Yeah.
I don't apologize for being a woman ever.
No.
I don't apologize for being a girl. But I think you have to recognize that if you fall back on old paradigms, you may not be recognized in your workplace. And then you can't simply blame the workplace. I believe you've got to bring part of it to the table, mm-hmm. and your workplace has to meet you there.
Yes.
So it is a both and, I believe.
It must be a win-win, and you must be in alignment,
right,
with your partnership.
Yes,
at all times. Absolutely, you must have the same vision and the same goals.
Yep.
Yes, absolutely. It's so key, Marcy. Everything is so eloquently said. I love that. Absolutely. And so you are also a mother, and you're raising 2 beautiful power women who I have seen in the community. They are. And you've done an excellent job at that, at least from an outsider's point of view. And
Thank you.
Yeah, absolutely.
Far from perfect.
Now, I always say my children are perfectly imperfect.
It's good description for mine as well. And from my approach to motherhood, that's for sure.
Yeah. And so looking back over that journey thus far, what are the key things that you can look back and see? What has it been that have allowed you to raise those powerful women thus far to be such examples?
Yeah, I think my girls, they're now 23 and 20. I have worked their whole lives.
Mm-hmm.
I think they saw that it was doable, that it was actually, for them, it was very normal to have a mom who got up every morning, put on work clothes. For me, it was business dress. It could have been any other uniform, depending on what work you're in, and went to work and came home, but was still there at their performances when they were in orchestra, still there to edit an essay, quiz them on a test, mop up their tears when some mean girl said something ugly to them in middle school, all of those things. So they saw it firsthand that a woman could have a husband, be a mom, and go to work. And that it wasn't always perfect. And sometimes I had to apologize if I came home tired and snippy. They learned they could call me out on that.
Nice.
So they saw it by role modeling. They were also given permission to be what they wanted to be. We talked early on. One of my daughters in particular used to talk about being a mommy and all that came with that in a traditional sense. And then there was a question, well, but you're different, Mom, but what if I don't want to do what you do? And being told no one's expecting them to follow in my pathway, that they've got to understand what their own dreams and ambitions are, and then I will be there to help them make that path forward.
Yeah.
We also talked a lot about them as women in particular, young girls, then teenagers, and now into early adulthood, that they have to be willing to own their decisions. And we talk about that in their choice of schooling and professions. We talk about that in their own sexuality and all those things, that as they grow up and get pressed into certain situations, the answer's got to come from their heart on what they choose to engage in or not participate in or not pursue or not. But it's their choice. And if they make a choice, I may not always agree with it, but if they made the choice, then I'll be there to support them.
Right.
Those were some awkward conversations sometimes, uncomfortable conversations. And even today, they'll make a choice, and I think, that's not what I would do. But if they were not pressured into that choice by society or another person or a man, then that's their choice, and I'm there to stand them up. And I think those have been some interesting conversations we started probably about the time they were 13 or 14. How do they create but we used to call it their bubble. This is my bubble. And that was their personality, their physical space, but also kind of their emotional space.
Yeah.
And it was up to them to let someone into their bubble. And it was okay for them to say, no, you're not going to be in my mental, emotional, or physical space right now. I don't give you permission.
Nice. Those choices and those expectations that we all have to set, and learning how to set them at a very early age.
I used to tell them every time they left the house, and I will still do it now, and they tease me about it, particularly my 23-year-old, but when they would leave to go out with friends or on a date or even just go, if I was leaving for a trip, I'd say, have fun, be safe, make good choices. And that's this kind of mantra in our family now, that it all comes as that one package: fun, safety, making good choices.
Nice. Very, very nice. So Marcy, where is Children's Hospital in 5 years?
We're going to still be at One Children's Way. Oh, sorry. A little smart aleck remark.
Which, to clarify, is the address.
Is the address of Arkansas Children's Hospital right here in Little Rock. I would say in 5 years, we will probably have our brand planted. So either because we own and operate, or we're just in partnership with others, in at least 10 more locations across the state than we are today.
Great.
When I think about 3 to 5, it's probably even more than that. So that if you were to draw a map of Arkansas by county and be able to place dots on the map of where is Arkansas Children's influencing the health of children, it will be at least 10 more dots than it is today. And we're actually in a lot of places already today.
That's incredible.
I think you'll see that's where we spend our energy on those kinds of relationships, those kinds of resources out in communities. We will keep our big campuses neat and clean and modern and with the best technology.
Yeah.
But I don't think you'll see lots of bricks and mortar growth where our 2 hospitals are. And I don't think you'll see a 3rd hospital. I'll be really surprised if it's a 3rd hospital. I think it will be places more intentionally focused on health. So how do you alleviate asthma issues in the small communities? How are you working with newborn nurseries? How are we getting our dental program out across the state? Oral health is one of the biggest problems in Arkansas. Mm-hmm. We have 3 dental vans today. We have a 4th under construction. My hope is in 5 years, you see 3 more dental vans so that we might have 7 dental vans bringing dental care to schools all over the state. Mm-hmm. I think that's where our energy will be in 5 years.
Excellent. How can we be of help to children's?
I think the broader community, moms in particular, and women as well, even if you are not a biological mom, mm-hmm. I think women need to raise our voice as advocates for child health. So one of the things I have told very specifically to Governor Hutchinson is that I would like Arkansas Children's as the institution to be the go-to institution in the state of Arkansas about all things child health. But again, that could potentially limit us to one voice, our voice here at Arkansas Children's. But when we look at how policies are made at the state level, how policies are made at the federal level, so many times the children's voice or the children's advocate is not part of that conversation.
Right.
We saw that last year in Washington with all of the repeal and replace conversation around Obamacare. And I'm not going to get political here by any means, so it doesn't matter which side right. of the conversation you were on.
Right.
If you listened carefully to the debate in Congress, mm-hmm. it was never about children's health care. And somewhere we have to elevate the politics of children's health care so that it is a very active part of the conversation. Mm-hmm. And that crosses all party lines. And what we like to say at Arkansas Children's is we do not support any one party. Mm-mm. But we are strong advocates for policies that enhance the health of children. And often that voice is missing at the table. And that's what I can use from all of you who are listening, your family, your friends. What's got to be good for kids will be good for all of us. Because one key fact that's kind of new in the conversation lately, for the first time ever in the history of our country, we as a human race are not replacing ourselves. Women are opting to have no babies or fewer babies. And there are now not enough children growing up who will be constructive, participative workers in the work world when you and I and people our age are old to take care of us. There won't be enough taking care of us in nursing homes. There won't be enough contributing financially to things like Social Security and Medicare. We as a human race have stopped replacing ourselves. And because of that, we're at risk of not having enough workers in the workplace to do what we need. So those children, the children of today, need to be really healthy and really strong and really smart when they get out of school, because I'm going to want someone taking care of me. And that is a new paradigm from a population standpoint.
That is.
I need you as advocates for children. I need you to be participants in the politics of children's health care.
Will do.
It's a big ask. I'm happy to go into it in more detail one-on-one. Someone can message me or come see me in my office. I'll tell you what we can do together.
I got it. Thank you so much for the clarity on that. Clarity is such power. And until we have that, we can't move forward and make progress happen. And that's my hope for this platform.
Oh, good.
Yeah, well, I believe in order for women to grow and make progress that we connect through business.
I agree.
This does. Yeah. And so
I applaud you for that, Claire. Thank you.
Thank you, Marcy. No, it's my pleasure. Thank you so much. And I appreciate your time, as time is our largest commodity. So thank you so much for your time and for your wisdom, your knowledge, and the clarity so that we may all make progress, move forward for the help of our children. So,
glad to help. I'll talk to anyone about child health. It's hard to shut me up on that subject. So thank you.
well, so now we know how to have time with Marcy is to say, hey, you want to talk about children's health?
Absolutely. That and a glass of wine, I'm good.
Ooh, done. Thank you so much, Marcy Doderer. You have a fantastic day, and I can't wait to have more conversations with you.
Thank you. Appreciate the opportunity to tell about Arkansas Children's and tell a little bit about my story. Have a great day.
You too. Bye.